This is the Emergency Medical Minute, sponsored by CarePoint and HCA Health One.
All right, guys, so we're in the middle of respiratory season now, so I thought I'd take a little bit of time and go over some of the cough suppressants that we typically are using for patients. I think last year we ended up talking about cough suppressants you could or could not use in pregnancy. Today we'll talk just sort of about general population concerns. The short of it is that not a lot is really proven to be efficacious, including most of the stuff that you get to take over the counter. So Dextromethorphan is probably the most common cough suppressant. Anytime you see a med that has a DM on it, it actually stands for dextromethorphan, and then you can actually buy like Robitussin and stuff like that. That's just pure dextromethorphan. And it is, at best, maybe minimally efficacious, and at worst has some side effects to it. That is usually also what patients have access to over the counter, so it's very rare that someone's coming in asking for us for that medication. Guaifenesin is another med we see a lot that is meant to be a med for mucus. Like Mucinex has guaifenesin in it. A lot of your severe cough and cold meds have guaifenesin in it. And the goal there is to thin the mucus. Hasn't been proven to be more efficacious than telling the patient to drink a lot of water. So oral rehydration and oral liquid intake has been proven to be just as effective. Again, another option that they have access to over the counter. We see a decent number of people just saying, like, I can't stop coughing, please I know I have a cold, just please make the cough stop. And so that's when we start thinking about more prescription drugs, typically. Probably the thing in terms of a mechanism of action that has the best chance at helping with a cough is anything with codeine in it. The problem with using codeine is that everybody has a different way of metabolizing it or kind of a different rate of metabolism. And so basically giving somebody codeine, you're giving them a medication and you don't know how long it's going to hang around for. So if you have somebody who's a really slow metabolizer and you say, it's fine, go ahead and take this every 6 to 8 hours, there's a chance they haven't metabolized their first dose by the time they're taking their second, and those can compound and create opiate toxicity. So very risky for that reason. It's not recommended at all in kids. The way it works is actually by suppressing your cough center in the medulla, but you can think of that also as basically if you can't breathe, you can't cough. So again, maybe not the best thing to reach for. Tessalon Perles is something that people will come in specifically asking for, and the way that works is sort of as a topical anesthetic. So it's meant to sort of numb the oropharynx and even down to the top part of the esophagus to try and help kind of decrease that cough reflex. We tell patients not to bite it or chew them because there's a chance that if you get all of that medicine released at once, you might have such a numb throat that you would, in theory, stop protecting your airway. I'd say the bigger risk than that, because obviously people don't heed that all the time. I'd say the bigger risk than that is really that in kids, it can be really, really dangerous. And so in kids under 2, as little as 1 pill has been associated with seizures, tremors, cardiac arrest. It's a big deal in little kids. So if you are thinking about sending someone home with this, you really want to make sure that they don't have kids at home or that their meds are in a safe place. And again, the efficacy is a really old med. It's been around for forever. The efficacy is sort of mixed. Like it may not even be all that, it may not be worth the risk in general. Something that I have done a couple of times, which has been shown in case studies to have decent efficacy, is inhaled lidocaine or nebulized lidocaine. And these are for really bad coughs that they're like, I just can't sleep, or maybe like a cancer patient with a chronic cough, COPD patient with a chronic cough. You can do like a 1 to 2 mg per kg lidocaine, whatever the most concentrated you have. So for us, the liquid lidocaine we have is 2%. That's the most concentrated we have access to. You put it actually in a nebulizer like you would for an asthmatic, and then they inhale it. You have to warn them that they are going to have a bitter taste because it does not taste good, and that they're probably going to get some numbness around their mouth. In a different patient that we weren't giving this as a nebulized form, that symptom would start making you think about a lidocaine or a local anesthetic toxicity. So in this case, you want to tell patients that's going to happen. I know that's going to happen. Then, you want to keep them NPO. You want to keep them on a monitor. And typically, for a few hours at least, you'll see that there's an improvement in this severe cough symptom. I don't have a good answer for how long this lasts for. What I can tell you is that when we use certain types of anesthetics, say for a hip block or a local hip block, you'll see that even though the med wears off, so the actual anesthesia wears off, the analgesia can last much longer than that. So when we talk about giving patients a hip block for a hip fracture, we do it in the emergency department. They're not numb after 8 hours, but they're probably still getting some decent pain control. So I can't say that that's been studied. I don't know how long a nebulized lidocaine is supposed to work for, but maybe you give them a little bit of relief, and the hope is that maybe this is sort of like an indefinite resolution. For kids over 1, in kids specifically, the over-the-counter stuff that are like kids' cough medicines are generally not recommended because a lot of them are like naturopathic, not regulated by any sort of like FDA, and can have all kinds of crazy things in them. They also tend not to be that efficacious. There's some weak data that honey is helpful and that the Vicks Vapor Rub on the chest is helpful when compared to things like placebo and just petroleum jelly on the chest. For the honey specifically, they need to be over a year because of the risk of infantile botulism. But it is shown to be like a little bit better than doing nothing. My pediatrician for my kids, when they have coughs, make us brew this basically like really strong tea. So it's like thyme, like the herb, brew it till it's kind of bitter almost, and then you put honey and lemon in it and give them little spoonfuls of that. They like it. It tastes terrible to me, but it does seem to help at least in short bursts for like cough suppression. And then in anybody who's been coughing for over 2 weeks, you want to also think about like post-tussive emesis, these like more chronic coughs, and they don't have a reason to be coughing for that long. Like they're not a cancer patient, they're not a COPD patient. Those are patients you want to start thinking about pertussis. Immunity that we get from Tdap tends to wane with time. And so if somebody's being really good and keeping up on their Tdap shots, an actual Tdap, not the Tenavac that we give that doesn't have pertussis, but actual Tdap, your risk of pertussis stays fairly low. But in patients who sort of space that out, or if they're coming in and getting shots of Tenavac just for like injuries and they don't get that pertussis protection, immunity does tend to wane. And so as people get older, they're at risk for it again. And that chronic cough, more than 2 weeks post-tussive emesis, you want to think about that. Even if they look like they're pretty decent in terms of their chest x-ray and their oxygenation, it may be worth a trial of a macrolide, like a Z-Pak. I think that's it.
This has been the Emergency Medical Minute. Thank you to our sponsors CarePoint and HCA Health One. Support from them and listeners like you helps us to continue providing free medical education to the masses. If you found this episode valuable, consider supporting our work and check out the link in our show notes.